Okay, we're back with another mini edition of Politics Done Right. Today with Ryan Skolnick. I had a problem saying that, as well as Max Cotterill. We are going to be discussing Medicare for All. You know that is likely the most important topic in the country right now. You are going to be receiving a lot of information to dissuade you from it. As you've heard many times on my programs, single payer Medicare for all should be the only option. Do not believe anything else anybody's telling you, whether it's going to destroy the markets, destroy healthcare, destroy the employment of many people. Many things have the semblance of truth, but are far from reality. And what I have here is two experts, two policy experts with the National Nurses United. Last year, we spoke to one of their leaders, and I went and got now two policy experts that I am going to play the devil's advocate, and they are going to tell me why I am full of it for thinking Medicare for all is wrong. Welcome aboard, guys. First of all, introduce yourself.
How's it going? My name is Ryan Skolnick. I'm one of the distributed organizers for the National Nurses United campaign to win Medicare for all. And thrilled to be here to talk more about what we're doing and to help you all feel a little bit more comfortable going out there and talking about Medicare for all to people who might have some questions.
And you are?
And I'm Max Cotterill, also on the organizing team at National Nurses United, working to build the movement to pass Medicare for all, and excited to be here.
Okay, now tell me, Max, why is Medicare for all, single payer Medicare for all, the solution we need to look to?
Yeah, I mean that's the basic question, right? But it's the only policy out there that will provide high quality healthcare to all Americans, not just access, not just insurance, actual healthcare to all people in the U.S. While simultaneously getting the out of control costs and greed of the industry under control. There's no other policy that will do it.
Okay, so Ryan, what I'm going to ask you first of all is let's get down to basic. When you listen to to many politicians on TV, what they tell you is, oh, Medicare for all is just a moniker, but nobody really knows what it is. Nobody really knows what form it takes. They are trying to put within the people's psyche some sort of confusion. Take that confusion away.
Medicare for all is a specific policy. It is a single payer system. Single payer meaning there is one insurance plan that everyone is under, provided by a public plan, the government. There's no private insurance for needed care. You want it for like Botox injections, I guess, if you want to waste your money on insurance for that. But there is no private option in a single payer Medicare for all system. And let me just say really quickly, when people say that, they're saying that because they're trying to water it down. Medicare for all is a term that polls well. So rather than saying Medicare for all bad, they're saying Medicare for all is my mediocre half-measure plan too. No, Medicare for all is single payer, and don't allow anyone to redefine it.
Now, I want to make a clarification. Some people are of the belief that Medicare for all is a Medicare that we know today that has a donut hole, that has problems with, that has a 20% copay, that has a deductible, all these things. That's false.
It's false.
Explain, Max.
Yeah, and it's interesting. I mean, the actual name of the act is the Expanded and Improved Medicare for All Act. So, when opponents say that, by passing Medicare for All, we're destroying Medicare, it's literally the opposite. We're not only expanding Medicare to cover all people, we're also improving it, to include long-term care, pharmaceuticals, mental health care, to actually cover everything that falls under healthcare.
Okay, now people are going to be, in order to make something that is so well thought out look problematic, there are many different angles that they are coming against. I don't know how much you know about viruses, but the way we got the AIDS virus attack is from many different angles, and that is how we killed it. Not from one angle, but from many different angles. That's how we got it under control. That's what they're trying to do with Medicare for all. So these are the things that they're saying Medicare for all will do. Number one, for those people who are their retirement investment in companies that are insurance-based, they will lose money. They said that all the people that are working in the insurance industries are going to lose their jobs. They said, look, many people love their insurance policies, so why not just have a public option? And because people like what they have right now, dissuade them.
So there was a lot there, but the one I really want to address is the public option, because that's something that a lot of people have been duped to believing is a good idea.
Right.
So there's two angles to it. First is it's easier to do than Medicare for All. No, it is not. So the Partnership for America's Healthcare Future, which is the front group for the insurance and drug companies, they have said that they treat a public option the same way they do Medicare for All, because they don't want any sort of expansion of government-provided insurance. So that shows you that they're going to fight just as hard. If you don't believe me, we're both from California. We had a ballot initiative in 2016 called Prop 61, which would have implemented one cost control on prescription drugs. The drug companies spent over $118 million to kill that one cost control. There wasn't even a major overhaul. So Medicare for All, public option, doesn't matter what the change, it's not going to be any easier. But on top of that, a public option is a bad policy, because what you're essentially doing is making it easier for private companies to price the sickest people out. When you get all the sick people going into a public option, now you see the public options costs skyrocketing because there aren't enough healthy people to balance out all the sick. You're going to create a death spiral. There have been 2 studies on a public option from the CBO, which have both said either, 1, it's going to cost more, or 2, it's not even going to dramatically expand coverage. So it's not even a good policy, let alone a substitute for Medicare for All.
And many people think that because there isn't, people don't have to be forced to buy insurance anymore, that somehow the insurance companies will get off. The public option creates a problem. But anyhow, tell me a little bit more about the loss of unemployment.
Yeah, that's another common concern that we get, and I think one thing that we're really proud about HR 1384 is that it includes something called a just transition, which it is very true that there are tons of people employed by the insurance companies, employed by providers to kind of deal with this kind of payment bureaucracy in our system, and really simplifying that bureaucracy is part of where Medicare for All produces such substantial savings. But just because we want to reduce the bureaucracy and streamline the system doesn't mean that we want to make sure that the workers are not crushed in that process. So the bill includes something called a just transition, which allocates a certain percentage of the total healthcare spending to ensure that workers are able to find new jobs, that they're retrained, that they're helped into early retirement if they're close, to essentially ensure that that they're not again crushed in the process of transition.
It's interesting because first of all, if we were to dictate policy based on, well, we want to keep people employed, in effect we're saying, do we want to overcharge people? Do we want to have a system just to create a healthcare system that prices a whole lot of people out just to create employment? That in itself is immoral.
Yeah.
I think what is great is that this bill says that since we have screwed up on healthcare, no fault of the average population, no fault of the worker, we are going to try to mitigate that. Is a good thing. But by no means, in my opinion, I don't know how you guys feel, by no means should we be concerned that, well, there are going to be less people employed in a business that need not have people employed.
Right.
I don't think that it has to be either or. I think that in addition to, as you see a reduction in the private bureaucracy, you need more people to process Medicare issues. So there's a seamless transition to a new job for a lot of these people. But it's like you said, it's not their fault that our system is so bad, so they shouldn't be punished for it.
And that's what the bill does. Now, how are you finding the fight? Are you when you're out there on the ground?
Yeah, I think I can speak for our team when I say that it's going really, really well. When you go out and knock on doors, we've had thousands of canvassing events across the country in nearly every state, where neighbors are going out and talking to other neighbors about Medicare for All and really galvanizing supporters to contact their representatives to get on board. It's an extremely popular issue. As you know, healthcare is at the top of basically everybody's concerns, and Medicare for All is across the political spectrum, really seen as the solution. So we've had a ton of success. We've had 3 historic hearings in Congress this year already on Medicare for All, and just about 2 days ago we got 2 new co-sponsors. So we're now one co-sponsor short of having a majority of Democrats in the House on the Medicare for All bill.
In that case, Nancy Pelosi will have to move.
Yes.
All right. Well, for whatever I missed asking, Ryan, tell me something I don't know, and then I'm going to ask Max the same thing.
So the one thing that I do want to address really quickly is the what if I like my private insurance argument, because that's something a lot of people make. People will say, yeah, I like my private insurance, but when you ask them what does that mean, I like my doctor, I like my hospital, I like being able to choose my care. You don't like your insurance, you like your provider. In fact, when people say they like their insurance, it means that their insurance is getting out of the way. So if that's how it's going to be, then let's make that the case for everyone. Right now, you may like your employer-based plan, but your employer could be one day away from deciding to change it to cut costs, and you have no say in the matter. People lose their jobs all the time. People's life circumstances change. So people don't like their health care. They like it when there's no barrier to their health care. So what Medicare for All does is removes that issue entirely by giving everyone essentially a guaranteed high-quality comprehensive plan that they will never be at risk of losing, that will never be at risk of being torn away from them just because they get hurt and can't stay on the job while they're recovering, or because they get incredibly sick. You're never going to have to worry about any of that stuff, and even better, the main benefit is that your doctor and you become the primary decisions of how you get your care. There's no insurance company bureaucracy getting in the way. If your doctor decides that you need certain thing for care, it will be covered and you will get that care.
Max?
Yeah, I want to just paint a brief picture. So we are living in a country now where nearly half of people are not going to the doctor because of financial costs. They're splitting pills in half. They don't have insurance. If they have insurance, they can't afford it. Nearly 50% of people. On the other hand, you have an industry that is making billions and billions of dollars in profit every year, predicated on the denial of care. The situation is really getting untenable, but there's a solution, which is Medicare for All. It's wildly popular. However, despite its popularity, despite the great bill that we have, it won't get passed unless we organize a mass movement to actually hold our elected officials accountable and elect ones that will fight for this. So what I would like to say is that we need people to get involved in this movement to do that. You can find out more information on our website, which is Medicare4all.org. We have canvases going on constantly. We're sending folks to legislators' offices. We're holding rallies, town halls. We're doing everything that we can to get people on board, and we're succeeding. But we always need more help, and we won't win without a mass movement.
A mass movement that is needed, folks. And I want to add one thing here to those of you that are listening, and think about this. This is very important. Many people try to scare you to believe that if you go to Medicare for All, the government has control of your entire health care, and you will be on waiting list and all these types of issues. This is important. Right now, that is what you have with your insurance company today. They tell you what doctor you can see. They tell you what medicines you can take. They tell you if the doctor assigns a procedure to you, whether they will approve you having it or not. That is the control of medicine for you. That is a private sector. That is a profit base telling you, no, you can't have it. Ryan Skolnick, it was a pleasure having you with me. And Max Cotterill, it's a pleasure having you with me.
Thanks for having us.
This is Politics Done Right. Until the next